This instructional video from Rutland Regional Medical Center has been prepared for you by our surgical team to help make your surgery day and surgery recovery go as smoothly as possible, and is meant to supplement any additional instructional materials you have received. It is important for you to follow the specific instructions from your surgeon's office. Included in the papers you receive before your surgery is the Patient Personal History Form. It is extremely important that you complete this form and return it to the hospital in the self-addressed stamped envelope provided as quickly as possible and before your surgery. If you have not received this form, please contact the Ambulatory Care Unit, or ACU, at 802-747-1741. In your packet of materials, you will have a pre-surgical booklet for you to review. It contains information on what you can expect before and after your surgery. This is also where you'll find your surgery date as well as the phone number to call the Ambulatory Care Unit at 802-747-1741 to find out your arrival time. You will make this call one business day prior to your surgery between the hours of 2 p.m. and 4 p.m. This packet also includes important instructions to follow before your surgery. You must follow these instructions. Failure to follow these instructions may result in your surgery being canceled. If you have any questions about these instructions, please call the ACU at 802-747-1741. Do not wear makeup, nail polish, jewelry, body jewelry, or contact lenses. Do not shave any areas to be operated on for at least 72 hours prior to your surgery. Stop diet medicines, over-the-counter diet medicines, and all herbal medicines for at least 1 week prior to your surgery. Surgery may be postponed if these instructions are not followed. Please report any changes in your health to your surgeon, including colds, flu, infections, or rashes. And finally, and most importantly, do not eat anything at least 8 hours prior to your arrival. You may have clear liquids up to 2 hours before your arrival unless otherwise instructed by your surgeon. Unless otherwise instructed, the following are the only acceptable liquids you may drink: water, ginger ale, cranberry juice, apple juice. Your surgery day has arrived. You will enter the hospital grounds via the Stratton Road entrance. Here you may be dropped off at the doors and walk inside. Or you can park your car first in the visitor lot and walk to the entrance. If you need assistance, you may press the Help button located on the far left of the double doors. Someone will come out to help you. If you require a wheelchair, you will find them just inside the doors on your left. Once inside, continue straight down the hall to the first intersection near the gift shop and retail pharmacy. Here, you make a left and you will see a bank of elevators on your left. Once inside the elevator, press 2 for the second floor. Take a right out of the elevators on the second floor and walk straight to the end of the hallway into the Ambulatory Care Unit, or ACU. Just inside the waiting room, there is a check-in desk. The receptionist will check you in and give you paperwork for you to review. Please pay special attention to the accuracy of your contact information. Also, at this time, your companion will be asked to share their cell phone number so that they can be contacted once you are in recovery. Once your paperwork is complete, an ACU nurse will bring you into the ACU and get you ready for surgery. This is where you will be weighed and provide a urine sample if necessary. You will change into a hospital gown and place your belongings in a locker. Next, you are placed on a bed and given a warm blanket. This is where you will wait your turn for surgery. At this point, your companion may come back and visit with you. You will have visits from several people who are a part of your surgery and recovery team. This includes the ACU nurse who takes your temperature and blood pressure. You will also receive your hospital identification bracelet. As a safety measure, at various times during your stay, you will be asked to confirm your name and date of birth. If you require an IV, it will be started at this time as well. You will also be seen by your anesthesiologist and your doctor, who will discuss your options for an anesthesia, including the possible need for a nerve block. When it is time for your surgery, your companion will be asked to follow the blue dots on the floor to the waiting room. If your surgery requires a nerve blocking agent, you will receive that at this time. Now you are ready for surgery, and into the operating room you go. Once inside, you will be introduced to everyone who's part of your surgical team. You will be given anesthesia and the surgery will begin. You are in good hands. While you are in surgery, your companion is welcome to go to the surgical waiting area. Here there are comfortable chairs and sofas, as well as complimentary coffee, free Wi-Fi, magazines to read, and a TV to watch. There is a volunteer available to answer any questions or concerns that your companion may have. Alternatively, staff members at the ACU check-in desk are happy to help as well. If your companion's cell number was shared during check-in, they may leave the second floor and explore other options on the first floor, such as the gift shop, pharmacy, and meditation room. Your companion may also visit our beautiful outdoor gardens and walking paths. Our food court is also available on the first floor, where hot and cold drinks, soups, salads, sandwiches, and more are available. Your surgery is now over and you are wheeled into the Post-Anesthesia Care Unit, or PACU, where you can safely recover from the anesthesia and slowly begin to wake up. At this time, your companion is notified that you are in recovery. The doctor updates them on your surgery and details that might be helpful in recovery. If the plan is for you to stay overnight, arrangements will be made for you to be moved to a hospital room. A nurse will bring your companion to your bedside once you have moved from the Post-Anesthesia Care Unit to the ACU. Here, your belongings will be returned to you, and when you can do so, you can get dressed to go home. This is also when you will receive your discharge instructions that are specific to your care and healing. It is important for your companion to be present for this so that they can also hear the special instructions. You will receive these instructions in a printed packet to take home with you and given prescriptions for any medications you will need. This would be a good time for your companion to talk to your nurse about your medicine, which can be fulfilled here at the hospital or at your local pharmacy. Time to go home. A hospital volunteer will come by with a wheelchair and help get you to the carport area at the Stratton Road entrance. Once outside, our volunteer will wait with you while your companion gets the car. Once you are safely inside the car, it's time to head home. At home, you and your companion should review and follow the discharge instructions that were given to you by your nurse. If you have any questions, contact your surgeon's office. You may also receive a follow-up phone call from a post-operative nurse. Thank you for taking the time to watch this video about what to expect with your surgery at Rutland Regional Medical Center. We look forward to taking care of you.